Imagine witnessing the heartbreaking sight of a newborn calf, once full of promise, suddenly succumbing to unexplained bleeding. This is the harsh reality for many dairy farmers battling bleeding calf syndrome, BCS, a rare yet devastating condition that can wipe out an entire calf crop in mere days. With its sudden onset and tragic consequences, BCS has been a mystery for years, baffling both scientists and dairy farmers alike. But understanding this enigmatic syndrome is crucial for anyone invested in the health and future of their livestock. Let's delve into the causes, symptoms, and impact of bleeding calf syndrome, exploring how it affects young cattle and offering insight into preventive measures. Let's unlock the complexities of this rare syndrome and explore how you can safeguard your herd from its devastating effects. Bleeding calf syndrome, also known as bovine neonatal pancytopenia, BNP, is a condition that strikes newborn calves, usually between 1 to 2 weeks of age. It is characterized by sudden, unexplained bleeding from multiple sites on the body, including the skin, nostrils, mouth, and even internal organs like the gastrointestinal tract. The outcome is often fatal, leaving calves with no chance of survival once symptoms appear. BCS is a heart-wrenching disease that can lead to the rapid loss of calves, impacting not only the financial stability of dairy farmers, but also the morale of livestock caretakers, who see their animals suffer without understanding the cause. Recognizing the signs of bleeding calf syndrome early is essential for managing the disease, though treatment options are limited. Look for these symptoms. External bleeding. Gums, skin, nostrils, mouth, and injection sites may bleed. Internal bleeding. Bloody diarrhea or dark, tarry stools could indicate gastrointestinal bleeding. General malaise. Affected calves might appear lethargic, have a raised temperature, and exhibit signs of distress. Post-mortem signs. Examination often reveals widespread hemorrhaging in vital organs and bone marrow aplasia, showing the destruction of blood-producing cells. The exact cause of bleeding calf syndrome is still uncertain, but research points to several potential factors contributing to its onset. Immune system dysfunction. An autoimmune reaction could lead to the destruction of critical blood cells, causing hemorrhages. Genetic factors. Some calves may be genetically predisposed to develop BCS due to inherited traits. Vaccination-related issues. A connection has been found between certain vaccines, such as PregSure, and the onset of BCS, with studies suggesting that vaccination practices may play a role. Environmental factors. Stress, management issues, or even exposure to toxins may trigger BCS in susceptible calves. The consequences of bleeding calf syndrome extend far beyond the initial loss of life. Dairy farmers dealing with this syndrome may face prevalence. A small percentage of calves in a herd may be affected, but the devastation can still be significant. High mortality rate. Once symptoms appear, survival rates are extremely low, leading to quick and painful losses. Financial impact. Beyond the loss of calves, there may be financial setbacks due to the need for increased veterinary care, biosecurity measures, and potential long-term impacts on herd productivity. Although bleeding calf syndrome currently has no definitive cure, proactive steps can be taken to reduce the risk. Revise vaccination protocols. Ensure you're using safe and approved vaccines for your calves, reviewing their potential side effects. Monitor calves closely. Regular checks for early signs of BCS can help you act quickly, even though treatment options are limited. Implement strict biosecurity. Limit exposure to potential environmental factors and diseases by maintaining high biosecurity standards. Consider genetic testing. In herds with a history of BCS, exploring genetic testing may help identify susceptible animals. Bleeding calf syndrome is a perplexing and heartbreaking condition, but knowledge is power. By understanding the signs, causes, and preventative measures, you can better safeguard your herd from the devastating effects of this syndrome. Awareness and vigilance are key, and while there's still much to learn about BCS, early intervention and thoughtful management practices can make a significant difference. Dairy farmers and livestock owners have the power to make informed decisions, and take preventive actions that will help keep their herds safe from BCS. Be proactive, stay informed, and prioritize the health of your calves. In doing so, you ensure the longevity and productivity of your herd, protecting both your livelihood and the well-being of your animals.